Alright, so I just finished up my respiratory and chest tube assessments. I noticed that Mary needed a dressing change, so I went out. I gathered all of my supplies. I'm gonna close the doors. I'm entering the room, wash my hands. Hi Mary, it's Holly again, your student nurse. I'm just back in. I grabbed all the stuff to do that dressing change that we noticed you needed during your assessment. Can you just verify your name and date of birth for me? And she does, and it matches her wristband. All right, Mary, so I'm just gonna take off that old dressing and I'm going to assess it, make sure what the drainage looks like, get an idea of where it's coming from. During that, I'm gonna have to cleanse that. Are you allergic to iodine or any kind of cleansing solutions at all? She says no, so we're safe there. All right, so I just need you to stay laying down, laying still. Maybe make sure you're not touching that tube or anything when I get the dressing off. Can you be sure to do that? She says yes, so I've assessed for her understanding and explained the procedure to her. She's able to follow commands. I'm going to wash my hands, put on some clean gloves. Take another attempt at that. I have a heck of a time with these gloves. All right, Mary, I'm just gonna take a quick look at that insertion site here in your dressing. I'm gonna feel around for crepitus, and if there were any, depending on facility policy, if it's a smaller amount or whatever, they may want on the new dressing for you to outline it, initial and date it and time it so that they know if it's growing or shrinking. If she had a pneumothorax, there may be a small amount of crepitus that they're monitoring anyways. So it looks like there is no signs of crepitus. So I'm just going to anchor the tube and take off my old dressing, working towards the insertion site from the outside. All right, and I need to get this other. All right, and I'm gonna assess my dressing for any drainage. I'm gonna note the color, odor, consistency, the amount, and then dispose of my old dressing in my biohazard bag. And then I'm going to inspect my insertion site for any redness, swelling, edema, or any drainage. I'm going to take off my gloves, wash my hands. And normally you wouldn't put the dressing on the bed while you're waiting to assess it, but I was trying to maintain the integrity of that one so we can reuse it on our mannequin. All right, so then I'm going to, before I put on my new gloves, open my sterile cup. Depending on agency policy on cleansing, it may be sterile water, maybe sterile saline. They may have a different cleansing agent on a no-touch applicator ready, but for this, we're gonna use some sterile water. Pour it in our cup. Open our sterile cotton-tipped applicators. And only touching the ends. Drop them. In our sterile water. And now, my hands are still clean, so I'm going to apply a new pair of clean gloves. And I'm going to nominate one of my hands to anchor my tube. And then I'm going to start cleaning around the insertion site, working my way out. And then once that's clean, depending on agency protocol, I could apply skin prep, but nowhere near the insertion site, over the insertion site, just where the adhesive tape will touch to protect Mary's skin. And then I'm going to remove my gloves. Actually, I'm going to keep this glove on and just get this cup out of the way so I don't knock it over or contaminate my soon-to-be sterile field. Remove these. Wash my hands again. And prepare my sterile dressings. So, Vaseline dressing, making sure not to touch anywhere near inside. Drain sponge, and my occlusive gauze. And then I'm going to get rid of the skin prep and wash my hands again, because it's going to be in the way. Open my pair of sterile gloves after my hands are washed. I'm not touching anything, and then I'm gonna where's the keep this up? There we go. Apply my first one, reach in the cuff of my second one. And apply my second one. And I'm going to start with my Vaseline gauze, not reach across any of my other dressings, not touch Mary or the tube, keep both my hands sterile, and apply this per agency protocol. Sometimes it's up right by against the incision, sometimes it's down a little farther. And I'm going to grab my drainage sponge and apply that over top my sterile gauze, lay that over the top, and then I'm going to unwind my tape. Since both of my hands are sterile, it's okay to do it with them, but I could take my gloves off and wash them and also apply tape, as long as I'm using a no touch and I'm not touching the inside of my tape. Wow, that one was short. Not touch the inside. That's going to be over the dressing. Stretch it across. And it's not sticking to this mannequin. I want to create an airtight seal with the tape down the dressing. So another piece. Sealing out any air. And one more time. Stretch across. And making sure that I have an airtight seal Then I would want to label this with my name, date, and the time of the dressing change. Gloves are coming off. Wash my hands. Cover poor Mary back up here. Cover Mary up. Make sure she's sitting in semi-foulers to promote drainage, unless it's contraindicated. I would make sure her side rails are up, her call light is within reach, she's safe, comfortable. I would dispose of all of my materials where they are supposed to be. Biohazard bag gets put in a biohazard bin or whatever agency protocol is. Dispose of my other garbage in the trash. I would go out, document after my hands are washed and I've exited the room, Mary's all safe. Document date, time of the dressing change, how it went, any assessments that were done during. And I think that's it.